My name is Marisol Nunez, and my grandson is Josiah Pena Green. When he came to live with me, he did have a lot of health problems, asthma, and he also have a sleeping problem, and he have anger issues too. And I started getting a lot of help for him.
Josiah was referred to the NRLP team as someone who may need assistance. His care team had been extensive and had included DCF, primary care doctors, specialists, and a psychologist.
The program connected me to a social worker, Juan. They asked me how I need help. And in that moment especially, I need help with economic empowerment and sport for Josiah. What Josiah wanted to do most, that it was gymnastic. And Juan helped me to apply for financial assistance for Josiah to go to gymnastic classes. He's been doing very well. He's talking about even going to college. And that was like, wow, that I can see that I can get some help for my grandson, for Josiah.
Marisol and her grandson's story are testaments to the important work NRLP does every day. The North Region LTSS partnership has been providing long-term support services to individuals between the ages of 3 and 64 since 2017. The care coordination spans nearly every aspect of daily life. In systems where specialists often aren't talking to each other, NRLP serves as a connective thread, identifying where providers may be duplicating services or where members are falling through the cracks entirely.
I'm Valerie Parker Callahan. I'm the Senior Population Health Director at Greater Lynn Senior Services. The goal of NRLP was essentially to improve the health status of the folks with whom we worked, because we recognize that health happens in the community. The clinical side of things, as critical as it is not really the be-all and end-all of health. Health is what you do every day. And so a support system that can really reach out to folks and connect them with resources that make it easier to navigate the day, that's what we're all about. Sometimes it's as simple as arranging doctor's appointments. Many of these folks may have 4, 5, 6 specialists that they're working with, and they need to understand better how to make certain that they get to the right appointment at the right time. Sometimes it's really about more basic health and wellness coaching. Sometimes it's around food security, sometimes around housing. Sometimes it's about parenting, sometimes it's about caregiving, sometimes it's about balancing work and school and family life. Very often it's about addressing crises that people are facing, because many of these families that we work with are in crisis most of the time. A lot of the crisis is related to insufficient resources, often money, but also other sorts of resources as well. Many of our members actually go to the ER less. They go for their annual visits more frequently. They go for their annual dental exams more frequently. So we have both the anecdotal evidence that this is an important program, as well as the data that demonstrates that individuals who have participated with us have actually reduced the total cost of their health care and have actually achieved improved healthcare outcomes.
But in 2026, federal funding cuts have meant that the state has had to cut its care management budget, forcing NRLP to dramatically scale back its operations.
One impact of less funding is we cannot afford to have as many staff providing services. That means that we do not have the ability to reach as many people as we would like. And some of what they will not get at this moment in time is supports around really basic health-related social needs like food, like housing, like mobility, like education.
The story of NRLP is not unique. Across the country, programs like it are disappearing, and to understand why, we have to go back about 100 years. The country was in crisis. The Depression of the 1930s wiped out savings, shuttered businesses, and left millions of Americans without work, food, or hope. The day FDR was inaugurated in 1933, he launched the New Deal program based on the idea that the federal government had a responsibility to its citizens, not just to govern, but to catch them if they fell. Social Security, unemployment insurance, federal assistance for families in need. These weren't just programs, they were a promise, a social contract.
Nor need we shrink from honestly facing conditions in our country today. This great nation will endure as it has endured, will revive and will prosper.
The booming post-war economy also meant many households were enjoying a better quality of life, and the social contract included new programs. The Great Society of the 1960s brought Medicare, Medicaid, food assistance, and Head Start, extending that federal promise into health, nutrition, and education. The belief was clear: no one should fall so far that they can't get back up. These and other programs were designed to create a stronger society, reliant on all of us. But the contract began to erode. The post-war boom crumbled, as did stable employment. Inflation and the price of oil jumped, and protections in the workplace gave way to corporate profits. Welfare was reframed as dependency. Many programs became conditional and were fragmented, and in moments of crisis, less reliable. The safety net didn't disappear. It just started fraying at the seams. Today, the costs of housing, food, and healthcare have outpaced wages for millions of Americans, while the public infrastructure meant to absorb that pressure has continued to shrink. What we're watching now is not just a budget decision, it is the latest chapter in a long retreat from that original promise. So, if the social contract said the government would catch you when you fall, who is actually catching people now? The answer increasingly is communities, nonprofits, clinics, neighbors. Organizations like NRLP are now stepping up to coordinate resources and complex funding systems without the power or support our federal systems once guaranteed.
It has forced us to really think about what is critical in our model. We tried very hard to look at all of the data that we accumulated over the 9 years to understand better how crises really get triggered for these families and how can we intervene more swiftly. One of the areas that really came to the fore as a red flag is food security. In many ways, what's going on in the refrigerator is a red flag about what is happening in the family as a whole. So when we would discover that there were parents not eating so that their kids could, or there were meals that were being skipped and so forth, that was often a pre-signal to what was going to happen in terms of a tremendous health crisis. Our new model really is going to focus a lot on food and food stability. We are going to make certain that all of our members, all of the folks with whom we work, understand as much as they can how to manage food as effectively as possible and have access to food as a resource, as a stabilizing force. We really see ourselves now as more as a community stabilization engine, right? With food security being a primary clinical lever that we can use in order to make certain that we are able to address the stabilization issues as swiftly as possible. It won't always be all about food, but food is a big signal and food is a big support. And so if we're able to hold that constant, then we can work on some of the issues more effectively.
I'm very happy the way the Josiah has been doing, from a boy with the health issues, but also with the bad temper. And then he learned how to be more calm, you know. To all of you, thank you so much.